Okay, everybody can see the skin or not?
Yes.
Yes.
Okay. Oh, okay. Okay. Good afternoon, everyone. Thank you all for coming today. We are here to talk to you in the topic of how to prepare for sample and process for clinical microbiology. The presentation is divided into three parts, including of patient preparation for sample collection, collecting clinical sample, and the last one is how to transport and process a sample. Let's start with the first part. It is about patient preparation for collecting sample. First, we should concern that aseptic technique is required in this procedure in order to prevent contamination. So today we have an example about how to perform this step. In a case of bloodstream infection, urinary tract infection, and pyothorax, we use aseptic surgical preparation by clipping hair and disinfecting skin at venipuncture site with antiseptic solution such as povidone iodine solution or alcohol chlorhexidine. For diagnostic chronic wound abscess and otitis externa, both cases use non-antiseptic solution to clean an area that we choose to collect sample. In chronic wound abscess case, performer should irrigate the wound or abscess with sterile saline in order to remove surface exudate or any remaining necrotic tissue. Then, using gauze to remove excess saline from the site. After that, allow the site to dry or whip dry with sterile gauze pad. And in the case of otitis externa, clean ear canal with non-antiseptic solutions such as normosolide to reduce contamination before collecting sample. Okay, now I finished the first part and I'm moving to the next one. It is about how to collect a clinical sample. Even though each of case in the clinic we perform this procedure differentially, every case should be done it correctly and aseptically. The first case that we are going to talk is bloodstream infection or sepsis. After we fully complete prepare venipuncture site, select one saline and needle capable for collecting enough blood for aerobic and anaerobic blood culture bottle and plan to inoculate for each blood draw. Don't forget to bring a bottle to a room temperature before collecting sample. The bottle can be inoculated with any volume from 0.1 ml to 5 ml of blood. Use the volume appropriate for size of animal which specimen is collected. Generally, bottles are inoculated using 1 ml of blood from cat or small dog and using 2 or 3 ml from large dog. Then, collecting blood aseptically and using double needle technique by replacing drawing needle with sterile needle to inject blood sample into aerobic and anaerobic blood culture bottle. Once you done that, remove protective top of the screw cap on the blood culture bottle. Finally, disinfect the visible part of the rubber stopper by using 70% isopropyl or ethyl alcohol and allow to dry or whip dry with a sterile gauze pad. The next case is pyothorax. We perform thoracocentesis to collect pleural effusion. This procedure not only be used for diagnosis but also therapeutic treatment to help patients if they have dyspnea or have infectious material in pleural space. First, preparing patient by placing in sternal or lateral recumbency posture. Next, the site for thoracocentesis can be identified using anatomical landmark between 7 to 10 intercostal space. Similarly, ultrasound can be used for more reliable identify landmark for thoracocentesis. After we finish sedation and preparation, insert a needle through the skin, then connect to the extension set and apply gentle negative pressure. A release in pressure should be felt when the needle enters the thoracic cavity. A small portion of the fluid, approximately 0.5 to 1 milliliter, should be placed in a screw cap bottle in the event culture and sensitivity are required. The remaining fluid is placed in EDTA containing tube for cytological analysis. So this is a technique to collect sample for pyothorax. Now we're gonna talk about collecting clinical sample of audited external case. To collect a sample in this case, specimens from the external ear canal are picked up during physical examination and otoscopic examination of the ear. After we finish patient preparation, sample of ear secret was collected using sterile cotton swab, and each ear was sampled with a separate swab to determine if infections are bilateral or unilateral. First, rubbing a dry cotton tip along the junction between the horizontal and vertical ear canal and rotate several times to collect sample. Then, lowering the swab gently on a microscopic slide with complete revolution of the swab tip to prepare for bacterial examination. After that, if we suspect about bacterial infection, swab for culture and susceptibility should be placed in transport medium such as charcoal transport medium, and the sample should be sent to laboratory as soon as possible.
Let's move to the correcting clinical sample of urinary tract infection. For correct the urine, cystogenesis is the best method. It was more sterile than voiding or catheterization. The purpose for correcting urine is for bacterial culture. To correct the urine, start and prepare the patient with scrubbing and disinfecting at the ventral abdomen with 70% alcohol and betadine. Then transport the urine in a sterile screw cap bottle and send to the laboratory as soon as possible. Okay, let's move to the correcting clinical sample of chronic wound and the abscess. For the chronic wound, we will start at physical or chemical stain. Irrigate the wound with the sterile saline. Importantly, we must avoid pus, debris, or necrotic tissue for sampling. Then, rub the swab in the affected area and avoid contaminate with the sites that have a commensal microflora, such as skin and mucous membrane. Then, press the swab into a transport medium. If it was processed within 2 hours, keep it in the room temperature, otherwise refrigerate the swab until shipping. For the abscess, for correct the sample from the abscess, start at aseptic technique on the skin surface. If the abscess can be drained, use a swab deep into the lesion and firmly sample the lesion advancing edge. Then press a swab to aerobic transport medium. If the abscess can be drained, use the fine needle aspiration technique by using a sterile needle and saline. Then transfer the aspirated material to an anaerobic transport medium and send to the laboratory within 2 hours. Okay, the last topic is transportation and sample processing. We must label the sample bottle with animal name or the ID, and label the date and time of sample collection, and label the method of collection in the case of urine collection, such as cystogenesis, voiding, or catheterization. Every specimen should be sent to the laboratory as soon as possible. If we can't send them to the laboratory as soon as possible, the specimen should be refrigerated, and if more than 2 days, the sample or tissue or the exudate should be frozen, but except the blood culture bottle and pleural fluid that should remain at the room temperature. For the blood sample and urine sample, they should be performed the bacterial culture to provide the diagnosis of bloodstream infection and urinary tract infection. to select the proper antimicrobial for the appropriate treatment. Thank you for your attention. Do you have any question?
I have a question. Questions. What is the difference between function?
Please introduce yourself first. And
my
which
name
group
is
you are?
สุภชัย โรจน์ อัศวเสถียร Group 5.
Group 5, right? Yeah, go on. Thank you.
I want to know what is the different function between odour transport medium and charcoal transport medium, and why we use it in otitis externa case.
Okay, I will answer your question. Okay. Is from my research, the use of charcoal in transport media. The researcher said that the charcoal in transport medium can neutralize toxic material in specimen or on the swab and facilitate the growth of sensitive bacterial pathogens such as some necessary gonorrhea, like that.
Then there is a
sorry, Atanuvi.
sorry.
Can everyone turn on the video for make it like the real classroom? Because I can hear only voice, but I cannot see your face. Yeah. Okay, sorry, Atanuvi.
Yeah, I just saw the questions in the chat box. So moderators, and you may read the question there.
Okay, please turn on the camera if it's possible.
Please point to your face, not on the ceiling or floor. So about blood sample collecting, right? Yes, please.
Can you please look into like hemoculture? Show the picture. Hemoculture, please. Like you see variety of color in hemoculture, right? I want to know the difference of it, the characteristic or something like that. Oh, sorry, I forgot to introduce myself. My name is Diag from Group 3. Thank you.
Example you can see the picture of hemoculture. The purple one is an anaerobic medium. It's a lytic anaerobic medium like blood cell and releasing intracellular organism. But like the blue one is a aerobic medium, and and they have a plus anaerobic medium, and for the is different because each of hemoculture have characteristic to neutralize bacteria differently, so it make them have many colors like that.
My name is Vasaporn Varapanyanan from Group 3. I have a question about hemoculture too. Why we have to transport hemoculture in the room temperature?
I think it may be if you want to culture the bacteria, if you freeze them or refrigerate them, the bacteria was dead and you can culture them. And
thank you.
Excuse me. Panita Chai Vichit has a question from Group 3 about blood sample collecting, since bacteria and fungi may not be constantly present in the bloodstream. How many sample sets should be collected?
Okay, let me answer this. We should collect 3 times within 24 hours from separate venipuncture. Hello.
My name is
Sorry, I want to answer. In the standard, we collect two samples for anaerobic and aerobic blood collection, blood culture bottles. Okay.
Okay, my name is Satapongkot Maniwong. I have a question that why do you have to collecting blood by double needle technique?
To protect contamination from commensal bacteria from skin. I think.
My name is Shiananti Thanwat from Group 4, and I have some of the question that about the blood collection too. And I want to know that is there any issue of the blood clotting? If the blood is clotting, is the sample can be cultured in the blood culture bottle or not?
Hello, Shayanan. I beg your pardon, could you repeat your question, please?
My question is about, is there any issue about the blood clotting sample? If the blood is clot, is that sample can be used to be cultured in the blood culture bottle?
Shianan, can I ask you, did it clot in the syringe or in the bottle? Because if it is clot in syringe, it can't push out.
Maybe sometimes it will go out with the clotting, but like little bit of the clotting is not obstruct in the syringe, but it's not the something like, I don't know that can it be clot in the bottle or not. But sometimes when I'm in the clinical, but sometimes that in the syringe can be is clot but not obstruct. Do you understand me? I don't know, so I asked.
Yeah, it clot and it
question.
can pass through the needle.
Yes, like a little bit clot. Is it the issue or not, or it can be used? But it's not a serious question. Just wanna know. Yes.
Okay, so I searched for your question. In the literature, they have a clot. They call clot culture. It's a modification of a blood culture. And in the clot culture, the blood is allowed to clot. Because the advantage of clot culture is that serum can also be collected and investigated for serological tests.
Okay, thank you.
Sorry for interrupting your time. Please see the comment chat. Now it's time up. Another question, please comment, and Group 1 can reply.
Thank you.
So then, in case if instructors or your advisors in this group can give a comment or give some more information in terms of incomplete answering, you may use this time. Or Ajahn Dirt, Ajahn Top.
Okay.
Do you have any comments? Yeah.
I think I have to comment in the chat box, so I focus about that. Okay, if I have a time for comment, I have two comments. First of all, for the cord blood, I think we cannot use because it's different purpose. The order of group 1 said that can be used for serology. That one is for serological test or immunological test. It's not for the blood culture system. The blood culture system you need not clot blood because the bead in the medium have to trap with the pathogen in the blood that you draw into the vessel. The second comment, I heard that the presenter said that the media in the bottle will neutralize the pathogen, something like that. Actually, it's not neutralized. It's different color in each bottle because the media in each bottle is appropriate for each kind of bacteria. For example, anaerobic bacteria, streptococcus, Neisseria, or another kind of bacteria differently.
For this group, I have two questions. The first is, do you know, are there any special agents in addition to the media include in blood culture bottles, and what is the function of that agent? In addition to the medium broth that enhance the growth of the bacteria in the blood. So are there any other agents that compose in blood culture bottle that help and enhance the growth of the bacteria?
Okay, please give me a minute to answer your question.
Yes, when you use the method, you should know the details and the concept of the equipment.
For I think the blood culture bottle, it have a content of special nutrient that help the bacteria to grow in the bottle and contain agents such as anticoagulant and agents that neutralize the natural bactericidal, and some reducing agent is added to the anaerobic bottle for growth of anaerobic bacteria.
And any other? So okay, when you use when you work on clinic, and when you use, you will see the beads include in the bottle because these are resin. These are resins that help neutralize antimicrobial in the blood when the patient were administered for treatment. So after the collection, the resin will help to trap and neutralize the antimicrobial in the blood and enhance the growth of the bacteria. And the one important is detector system. You know, when you see the bottom of the bottle, you can see like a dark, not clear bottle. This is the that help when the bacteria produce carbon dioxide. This will make the bottom clear, and the fluorescence will pass for the detector system. That means so the bacteria growth in the medium. Okay, and then the scientists will put it out and make culture on agar plates. And one thing you should know, this is another question from me. What is other application of blood culture bottle other than blood collection?
For diagnosis of the sepsis or blood bloodstream infection, I think.
Any other systems that we can use this bottle to collect the fluid? Okay, because the time is limit. So we can use blood culture bottle for collection of cerebrospinal fluid too, and also synovial fluid for diagnosis of bacterial arthritis or bacterial infection in spinal cord. Okay.
Thank you very much.
Okay. Thank you, Kuvan, for joining today. And I would remind you when there are 5 minutes and 1 minute on the comment, everyone is see this. And then group 2, now it's your turn. Please go ahead.
Okay. Okay. Hello, everyone. We are from Group 2. Today, we will present our infographics about fungal disease diagnosis, dermatophyte sporoticosis, cryptococcosis, and pityiosis. Let's start with the dermatophyte. There are 3 main pathogens of dermatophyte, which are Mycosporum, Trichophyton, and Epidemophyton. Dermatophytosis can cause ringworm lesion and lesion on pinal margins. This fungus can be diagnosed by many types of methods, which are 1. Trichogram. This method collects sample by plucking hair from the lesion. Positive results show spherical arthroscope or hypha on infected hair. 2. Woodlamp. Mycosporum canis infected skin shows apple green fluorescent, but negative results may occur in some strain of M. canis. 3. Culture. Dermatophytes are able to grow on specific medium called dermatophyte test medium. The colony from positive result shows white flat colony and change the color of medium from yellow to red in DTM with phenol red, or yellow to purple in DTM with bronchosol purple. 4. Dermatohistopathology show hypha invaded in hair or hair follicle and fungal spores surrounding the hair. 5. Polymerase chain reaction. PCR analysis is used for detection of genotypic difference in pathogenic organisms. It is more specific and precise than conventional method, but is rarely used for clinical examination. Next, sporotrichosis. Sporotrichosis is caused by the dimorphic saprophytic fungus Sporotrich sequentiae. The research found that the cats are the most frequently infected. The lesion in feline sporotrichosis with multiple nodules, ulceration, and draining tracts on skin. Canine sporotrichosis with ulcer on muscle and nasoplanum, with destruction of nostril and mucosal involvement. This disease can be diagnosed by 1. Cytology. Cytology can be done by impression smear on glass slide for microscopy or ulcerated skin or exudate. Smear or swab specimen tissue sample from biopsy or skin scraping, and also by aspiration of abscess and nodules. There are 2 phases of this fungi. In mycelial phase, show thin hyaline septate hyphae, typical flower-like arrangement, while in yeast phase shows cigar shape to oval or round budding yeast-like organism. 2. Culture. Due to culture technique in mycelial phase, S. sequentiae shows creamy white and brown, leathery and wrinkled surface, while in yeast phase shows yeast-like colonies of S. sequentiae are yellow to tan color and irregular surface. For this phase of sporoticosis require different conditions to grow on the plate. In mycelium phase can grow at 25 degrees Celsius on SDA medium with cyclohexamide and chloramphenicol, while in yeast phase at 37 degrees Celsius on BHI medium or brain heart effusion medium. 3. Dermatohistopathology. Histologic section of a skin lesion shows numerous cigar-shaped to oval or round budding yeast-like organisms. PCR and YTech identification can also be used to diagnose these fungi.
Okay, cryptococcosis. Cryptococcosis is caused by Cryptococcus species. Lesions of cryptococcosis are ulcerated skin nodule and also severe nasopharyngeal swelling and deformity. This disease can be diagnosed by 1. Cytology. Cytology can be done by impression smears from ulcerated skin lesions, fine needle aspirates of nodules, or bronchoalveolar lavage or CSF taps. If it is positive, we will find prominent capsule and narrow neck budding. 2. Culture. Cryptococcus is positive if brown to black pigment smooth colonies appear on the cafeic media plate. 3. Dermatohistopathology. This shows Cryptococcus gattii in the respiratory epithelium. 4. Rapid agglutination antigen test can be used. If it is positive, clumping of antigen and antibody particles will be formed. PCR and YTech identification can also be used to diagnose this fungi as well. And the last one, pityiosis. Lesions of pityiosis are swollen skin, non-healing wounds, invasive masses of ulcerated pustule nodules, draining tracts, and tissue necrosis. There are also symptoms of this disease which are fever, vomiting, diarrhea, regurgitation, long-term weight loss, and abdominal mass. This disease can be diagnosed by 1. Cytology. The best name for exudate cytology is gomoric methenamine silver or GMS that allow hyphal structures to be seen. Cytologic finding of the lesion shows contorted branch septate fungal hypha. 2. Culture. The colony from positive result shows white to colorless, irregular radiate pattern. The characteristics of fitting can be observed by zoospore. Zoospore of P. insidiosum shows short hypha, and picture at the bottom is P. insidiosum from plate cultures, showing sparsely septate hyphae in lactophenol cotton blue. 3. Dermatohistopathology. Samples can be collected from fine needle aspiration of enlarged inguinal lymph node or biopsy from injured skin fragments. Histologic findings associated with pityiosis are characterized by eosinophilic granulomatous to pyogranulomatous inflammation with fibrosis. ELISA can also be used to diagnose this disease as well. The definitive diagnosis of pityiosis has been challenging to diagnose because histopathologic features are not specific, and the organisms are not often successfully cultured. For PCR analysis, fungal isolation and tissue samples were submitted to amplify the regions of ITS1 and ITS2 by using polymerase chain reaction. The DNA sequences of amplicons from both samples show identical 891BP. ITS region, the phylogenetic tree was generated using neighbor joining analysis based on 10,000 replicates of bootstrap. For immunodiffusion tests, the culture filtrate antigens demonstrate the greatest capability for detecting precipitants and the greatest stability during storage. In contrast, the trypsinase antigens have the weakest capability for detecting multiple precipitants and the poorest stability. The 13 sera with proven active pityiosis were positive in immunodiffusion tests with the culture filtrate antigens. PCR and immunodiffusion tests are major roles to diagnose this fungi. Thank you for your attention.
May I ask a question, please? Hello.
Okay.
ได้ยินอยู่เนาะ
Okay.
ร้องเพลง
Yes.
ด้วยนะวันนี้นะ
The question is, my name is Apisit Wanglerm from Group 5, and the question is, these 4 fungal diseases, which one is the zoonotic disease and which one is not the zoonotic disease? Thank you.
For a physics question, we can get the dermatophyte and sporotrichosis from our pests, or these two are the zoonosis, but not with cryptococcosis and pityiosis. These two are not zoonosis.
Thank you.
Well, there are plenty of questions in the chat box.
Can I ask you a question? I'm Atitaya Pintanon from Group 1. I want to ask about the wood lamp examination, that I want to know about the percent of false positive, and if it false positive, what the reason that are possible?
For the false positive of a wood lamp, it can caused by when the vet is wearing a white gown, it can show a fluorescent too, and also for the soap residues on the patient's skin and can also cause a false positive too. But I may look for the percentage of the false positive. Wait a minute. For the question that asks about the recommend to diagnosis each disease, for the dermatophytes, we recommend to do the DTM cultures, and for cryptococcosis, I recommend to do a cytology. And for sporotrichosis, we recommend to use a culture. And the pityiosis, we recommend to do a PCR because it was hard to diagnose for this disease. But all of the method is depends on the cost that the client can pay.
Thank you. Which animal that is the most common for having pityiosis?
Pityiosis.
Okay. It's a dog, human, and horse.
My name is Kalakut Nulong. In dermatophytes, why geophilic species is more virulent than like zoophilic or arthropophilic species?
Okay, I will ask Namita a question. Except the cutaneous area, which area of the lesion of pityiosis can be sent? The area of lesion of pityiosis can be sent on GI lesion, and cutaneous lesion is common on dog.
So you still get a lot of questions that you need to answer in the chat box. So I got one notifications on the sporotrichosis. Let's look at that in terms of the cytologies. The cytology should not present like follow line arrangement. That structure is supposed to show in the lab. So after you cultures at room temperatures, and you can confirm the species by using the ultrastructures of the fungus. So that should have been in the right side together with the cultures and after the culture, because that structures cannot see in the clinical examination.
Yeah.
Yeah, it just comment, and all of the infographics, once you want to put the name of the pathogens, that should be like italic style ตัวเอียงนะ
Okay, thank you ครับ
And yeah, in terms of false positive or false negative, the dermatophyte, so mostly we found false negative from infect with trichophytans, and that trichophytans cannot give the positive with wood lamp, because most of these members pay like not ecto, is that endo infection. And also about zoonotics or non-zoonotic, yeah, all is the animals disease pathogens, and also have an evidence in humans, but we always concerned about contagious or non-contagious instead of zoonosis or non-zoonosis. So dermatophyte and sporotrichosis is very common contagious disease that can infect from disease animals directly to veterinarians and dog owners. But in terms of histoplasmosis, cryptococcosis, or pitiosis, is quite difficult to spread directly from animals to human, but also that still in definitions of zoonosis. But in terms of transmission is different.
Can I ask another question?
A little bit. One thing
Okay.
you may need to answer your friends about which one is screening test, which one is for confirmations or for using for final diagnostic. Because if overall of this one, maybe people don't know which protocol, which method should be used, like clinical examination, which one should be final diagnosis. Okay. Yes,
Okay.
then please.
My name is Kongpop Patapidusita from Group T. I have a question. If there are co-infection of several fungals, which method of diagnosis do you think is the best to differentiate species of the infection? Yes, but I can see the diagnostic method, YTech identification in many organisms. So in the first time, I think YTech is the best.
Yeah, okay, I do agree with you. And yeah, culture also useful. But I think the pathognomic lesion is very important, because firstly, we observe the first visitings on the clinic, and then you can create or hypothesize what happening to the dogs and cats. And then you have to pick which diagnostic tool will be very useful. So of course, the lesions from the dermatophyte and sporotic is quite different. But somehow the infects from yeast or sporotic may be mixed with bacteria. That would be called mixed infection. And cytology is the first line of diagnostics. It's very useful for all clinicians to rule out the disease. because that is the evidence area that you can create your hypothesis there.
For this group, I have two questions. The first is for identification of sporotrichosis by culture and YTech. Is there any specific conditions that have to be used before you use the YTech for identification of sporotrich species? Okay, this is dimorphic fungi, right? Okay, can you answer? So because the time is limited, this will be run out.
I think the YTech we have to use like make it into a yeast form before we Diag it.
Yes, we have to induce it to grow as yeast form by incubation at what temperature?
37 degrees Celsius.
Yes, because the YTech use the single cell or yeast form. And I have a question about GMS. For GMS, what composition and structure of the of pythium that the GMS stain?
Can I have a question again, please?
About gomori methylamine silver staining. What composition and structure of pythium that this the GMS stain? And can we use other spatial staining for histopathological diagnosis of pityrosis?
The GMS is detect like the carbohydrate on the hypha of pityrosis.
And are there any other spatial staining that stain carbohydrates that can detect pythium?
PAS can detect but less specific than GMS.
Yes, PAS can also stain carbohydrates. But okay, yeah, the answer is right. So that's all for my questions.
Thank you.
Thank you. Okay, it's done for my group. And next group T, are you ready?
Yeah, I'm ready. Please wait a
Okay.
minute.
Let's start it.
Hi guys, today we're going to talk about advanced diagnostic tools and indication of automated machine for identification and susceptibility tests. Advanced microbiology technologies have been improving our ability to diagnose infections. By increasing speed of clinical microbiology identification and susceptibility tests with convenience and high accuracy. The machines that are being used nowadays are YTech, Sensitizer, and Molotov. First, let's concentrate with YTech. YTech 2, an expert unique software system, represents an improved way to analyze and review your identification and antimicrobial susceptibility test or AST results. It incorporates an advanced understanding of bacterial resistance based on scientific research to provide rapid, automatic, standardized validation of every result and quickly identify the unusual results which need expertise of a microbiologist. Also help reducing the healthcare cost. This will help clinicians to stop empiric therapy and prescribe target therapy to immediately improve patient outcomes. YTech 2 compact with 30 card capacity uses photogenic methodology to determine individual biochemical reactions contained in a variety of microbe identification cards and a turbidimetric method for susceptibility test using a 64 wells card. Next, we're gonna move to sensitizer, a machine customizable identification and susceptibility testing solutions for laboratories of all sizes. The thermoscientific sensitizer microbiology system provides the ultimate in high performance, reliable ID and AST tests, utilizing true MIC results based on actual growth of the organism. The sensitizer system utilizes both in vitro diagnostic and research use only, with 96 wells microtiter plates containing several antimicrobial drugs, and each drug has a series of wells representing a range of concentrations, with over 240 antimicrobials available in extended dilution ranges on a wide variety of formats. Next, let's go to Molotov.
Molotov MS, or matrix-assisted laser desorption ionization, time-of-flight mass spectrometry, is used for microorganism identification in clinical microbiology laboratory. Molotov MS provides a rapid, accurate, and sensitive spectra of the sample. MALDI is a soft ionization that involves a laser striking a matrix of small molecules to make the analyzed molecules into gas phase without fragmenting or decomposing them. MALDI is appropriate to analyze biomolecules like peptides, lipids, saccharides, or other organic macromolecules. The MC ratio can be determined by the TOF, which detects and calculates masses of ions. Individual mass peaks provide valuable information for fingerprint of bacteria. This table shows the differences between simple diagnostic tools, the biochemical and culture-based approaches, and the advanced diagnostic tools, the YTech, Molotov MS, and sensitizer. As you can see, all the diagnostic tools require isolation, but Molotov doesn't. YTech, Molotov MS, and biochemical and culture-based approaches are all capable for bacterial identification, but not for sensitizer. YTech, sensitizer, and biochemical and culture-based approaches can perform antimicrobial susceptibility tests, but this is unavailable in Molotov MS. Biochemical and culture-based approaches takes the longest time to obtain a result. It may take from 3 to 14 days. For sensitizer, it takes about 18 to 24 hours. YTech takes 18 hours for gram-positive bacteria and 10 hours for gram-negative bacteria. Molotov MS is the fastest diagnostic tool to obtain results. It takes less than a minute. Molotov MS has the most expensive cost, followed by sensitizer. YTech and biochemical culture-based approaches is the cheapest. Biochemical and culture-based approach, YTech and Molotov MS are commonly used for routine diagnosis. Sensitizer is less common.
The advantages of biochemical and culture-based approaches are accessibility, necessary for confirmation, clinical and laboratory standard institute, and Bergey's manual standardization. The limitations are the risks of contact result consumed. It needs the PTA skill. Advantages of YTech are time consuming for most of bacteria, reduce manpower, less waste production, and reduce. The limitations are limitation on certain bacterial typing, used for only bacterial and antimicrobials available. Limitation on incomplete interpretation and the equipments are expensive. Advantages of multi-top MS are time-consuming reduction, for availability for most of bacteria, manpower, less risk, product reduce contamination validation, and scalable for protein marker screening. The limitations are limitation on certain phenotyping, unavailability for antimicrobial susceptibility tests, and the advantages of sensitizer are time-consuming reduction, for availability for most of bacteria, reduce contamination, data accessibility, clinical and laboratory standard in recommendation. The limitations are for bacterial typing and the equipment are. As you see, there are many diagnostic tools available for you guys as a clinician. Each diagnostic tools have their own advantages and limitations. There is no tool that suit all of the case. And depends on your to choose the most tool that give the best solution. Thank you.
Please feel free to ask.
Oh my
Mute
God.
microphone.
What is that happening?
Really? Sorry.
Opera song.
Silly, mute your microphone, please.
ข้างลงยุ้งไหมเนี่ย
I have a question about the my name is Chananiki Thanwat from Group 4, and I just want to ask that why you would say that multi-top is the most expensive or the most cost of the clinical sample, or you are talk about the whole of the equipment, because just like I just want to say that for each sample it may be cheaper, or anything that you can explain about this infographic.
It's expensive, just the matching, but like per sample cost is like only $5 to $5, but other is like more than $10. It's the cheapest one, but to buy in a machine is expensive. Understand? Do I answer the question?
So this infographic maybe talk about if the veterinarian just want some of the machine to their clinic, something like that. The target of the way you say the cost of the machine, not to say the cost of the sample.
Question again, please.
Yeah, that cost, that's cost in the poster. That mean the cost of equipment or the cost of per sample submission.
It is the cost of the equipment. If cost per sample multi-top is the cheapest among all these 4 types. Yes.
Personally, I think vet don't need to know about the cost of the machine, but all vet need to know about the cost per samples, or if we want to invest for submit the samples to any lab, so which lab provide which kind of the method and the cost of that. So I think it's gonna be misleading to the leaders if you still want to show up this kind of the issue. So you need to clarify what is the cost that you mean on the poster.
Okay, thank you. I will rewrite it to make the reader what. Okay, thank you.
Yeah, for additionally, so in terms of invest for all the lab equipment, we not gonna include the cost of, like we said, depreciation or ค่าเสริมราคา put in all the net assets values or มูลค่ามวลรวม that should be excluded for like analyze of the cost per samples. That's for veterinarian's perception. But in case of institutes, they need to calculate all of the thing.
Okay, I understand. Thank you.
Any more question?
May I ask the question?
ค่ะ
ครับ okay. It act as veterinarian if you would like to send the sample for identification and AST of the bacteria. Which one you will select for your case, for your patients? Like now you have four methods, 4 lines, right? Because I think this one in the laboratory we will not select for you. You have to check it out which method you would like to select it. A little bit more when you submit the sample in the request form, they may tell you about the price of each method also.
As we discussed, we would choose YTech because it is suitable for both fat identification and AST. And it is a reasonable cost.
Okay. Thank you. No true or false, because I just would like to ask your opinion, which one you would like to select. Okay, thank you.
Thank you for your question.
Can I ask you a question?
Yes, please.
I'm Ruchirat Ruchilek Sathon from Group 1. So I would like you to, could you please explain about a turbidimetric method process in YTech 2?
Okay, I will answer the question. The way to continuously monitor growth in as well. Growth in the positive control well is monitor until a predetermined minimum amount of bacterial growth is detected through stability measure is percentage of raw trans maintenance unit. The growth in the control will show that the test isolate is available growing at an appropriate rate to begin analysis of the various drug wells. Is answer your question?
Okay, I have a question. So when you you think you will use or found some new techniques, and what criteria that you consider these are advanced techniques or methods for diagnostic microbiology? What criteria that you think, okay, this technique is not only new, this is the advanced tools or the techniques for diagnostic microbiology, that what are the criteria? This is subjective, but okay, you can propose your idea. When compare with the conventional techniques.
Like, how can we call it advanced, like, right?
Yes. What criteria?
Compared to conventional? What criteria?
We think We think for a better diagnostic tools, it need to be less time consuming, and the result should be reliable, and it is convenient to use. And yeah, we think that these are the and it is a reasonable cost, not too expensive.
Okay.
These are the criteria we think it should have.
Okay, good. Okay, improve accuracy, right? And fast. And also, we will talk about the cost. So when the advanced technique was proposed to use in clinical practice, so in clinical research, they determine the cost effective of the methods. That means, okay, for example, when we use these techniques, but the cost is high, but the techniques that help to reduce the mortality. So this is cost, for example, this is cost effective. This is also a criteria that we use to determine the advanced tools. And I have a suggestion for this infographic for sensitizer. If you have seen the brochure or the specification sheet of sensitizer, there is also a platform for bacteria identification too. This is also the biochemical profile based method, like YTech. So this one you can correct. So the sensitizer can be used for species identification too. Okay, for my last question. So when compare between YTech and sensitizer, are there any advantage and disadvantage of these two techniques? In addition to you indicate in the table.
Sorry again, please.
In addition to the advantages and disadvantages of YTech and sensitizer, you show in the table, are there other disadvantages of YTech when compared with the sensitizer? In addition to just the not actual MIC you get from YTech.
Oh, okay, I understand the question. In the sensitizer, when you get the anti-susceptibility test, they can tell you break point of the antimicrobial concentration. That sensitivity or intermediate or resistant. But in YTech, they cannot show you that the break point. They can just tell about MIC and this antimicrobial was susceptible in the intermediate or resistant.
Both can show the level of the MIC too, and also interpret according to the breakpoint in the database. But from my experience, YTech is the fully automated system, but the sensitizer is just a semi-automated. When the YTech read the result, they read at first they see the control. If the control is not adequate, so the system does not read and report any result. So you waste the kits without any result from YTech. Okay, but for sensitizer, when you read, so you use the software, but you read by your eye. This is like, so we can say this is semi-automate. So you will get some result and can see what's happened from the bacterial growth from the plate. So you will get some results. And sometimes the control is not adequate. So you will see the control is not adequate. You can like get some results and confirm with the adequate positive or a negative control in sensitizer plates. So this is the disadvantages of a fully automated system. This is the risk if the sample is not good for the system for reading.
Sen.
Okay, sorry. It's enough time. Okay. And group 4, next group, are you ready?
Yes.
Okay. Let's do it.
Okay, so good afternoon, teachers, P-Boy, P-Dirt, P-Eek, P-Top, and my friends. Today we are from Group 4. We are going to talk about do and don'ts of sample collection for routine bacterial culture. My name is Jeremy Diag.
And my name is Chiananthi Thanwat.
Okay, so before we go any further, we would like to introduce that why is the bacterial culture is important. The importance of bacterial culture is because on our clinic practice, the bacterial culture is the way to identify the pathogenic bacteria that cause the abnormality in the animals. So before we go any further, there are two principles for every sample collection. The first one is good sample, good result. Because with correct method or correct sample size, it will increase more chance to culture the causative bacteria. And for another principle is aseptic techniques. Always aseptic technique because you could prevent the contamination from the normal flora or another bacteria from the environment such as nosocomial bacteria. So here are some of our advice. So consider it as a guideline, clinical guideline, something like that. For the first sampling site is the wound. What we should do for sampling from the wound is collect samples from active lesions. Active lesions is the area that still have bacterial activity, normally might be near the alive tissue. So we must perform the wound dressing with sterile saline before we sampling the bacteria, and also do not use antiseptic on the wound before collecting the sample. And what we never do is never collect pus or necrotic tissues, because instead of the bacteria that you get, you will have debris or neutrophil or macrophage instead, which can cause no growth on your plate. So what we recommend is exudative lesion isn't suitable for swab at all. You maybe prefer to clean the wound first. And for the second sampling site is nasal swab. Nasal swabbing is for chronic infection pathogens, which is more than 10 days with another systemic sign such as fever or anorexia. The bacteria that usually found in the chronic infection might be the secondary infection from fungal or tumor. So after we collect the bacterial sample, we have to Diag for further primary cause as well. And what we never do about in the nasal swab sampling is we never swab in case of acute upper respiratory infection, because in acute upper respiratory infection might be the contamination from upper respiratory normal flora, not a causative agent at all. So in the clinical case, if the animal comes with nasal discharge that was less than 10 days without another clinical or another systemic sign, it might resolve itself and we don't have to swab or culture at all.
Okay, the next one I would like to talk is about urine, and the special from urine sample and blood sample that I will talk next is it is a sample from the sterile environment. So it's important that we don't like to have the contaminate. Yes, okay, so I would like to talk about the urine sample before. Okay, about the urine samples, it will be some of the my script that look alike from group 1, but I will talk it again. Okay, from the urine sample, you have the best way to collect the urine sample is the way that to use the cystosynthesis technique, but more skilled, more sterile. If we don't have the skill for doing cystosynthesis, we can do catheterization or clean void midstream. But the way that we can diag for the bacterial culture is the quantitative cutoff. So the quantitative cutoff is about to see about the significant, suspicious, and contaminant from colony forming unit from the plate culture. And after that, we have to send the sample as soon as possible. The recommendation is about 30 minutes, but it is ideal because sometimes we are in the hospital or the outside clinic that we have to send the sample to the laboratory. So the maximum of the sample that can be storage is about 24 hours. If they are more than 24 hours, we should reject it. And we never, the thing that we don't must not do is never collect urine with swab or transport media. Okay, and the next one is blood. Blood is the one that we collect to see the bacteremia or septicemia. And the thing that we have to do is double needle technique to collect the blood and keep it into the blood culture bottle at room temperature. And we have to set the bottle for upright, not to upside down, something like that, and don't keep it in the refrigerator. It is the question from the friend that why we not have to put it in the refrigerator. It's like when you store your food, when you keep it in the refrigerator, the bacteria or the organism will not grow up more, something like that. But the target that we will have to culture this, we want it to be growth, and we want to see what is the causative agent of the culture. So we should keep it in the room temperature. And if okay, it's enough for blood culture. And the next one is feces. Feces is just not the sample in the routine culture. The routine culture is different from the routine diagnosis. We can use feces to find and root out the parasite, just like to send it under the microscope and see oocyte or alive protozoa. But for the bacteria culture, we don't do it as a routine because in the environment of the GI tract, we have many of normal flora, and some of the bacteria is the fastidious bacteria, just like Helicobacter, Campylobacter, and Brachycephera, or also something like that. So we have to cut the intestine, the colon, and tied up to be the vacuum atmosphere that has the least oxygen in the culture. So it will be more usually do this selective culture in livestock, because in the livestock you sometimes we've got the one that be representator 1, 2, or 3 sample per herd, and you can euthanasia and do the necropsy and send the culture to send to the laboratory for the culture, just like to representative of all herd. And for the conclusion, for do and don't, just keep in mind that we do the culture for aseptic technique to find the causative organisms, and good samples, good results. And the one that I would like you to keep in mind is the way that you have the good labels too. If you write the label of just like HN or about the history of the correct animal and to the correct sample, it will be good results too. That's all of our presentation. Please feel free to ask any question after this. It's the 2 questions in the comments box. The first one from Peter, that please explain why we should not collect urine with swab or transport medium. From only my opinion, I think that for the swab and for the transport medium, sometimes it have a lot of contaminants from the GI tract or of the environment, and the causative agents will be less than we got it as the fluid for 3 milliliter or yes, for more than 3 milliliter, and do just like for colony forming unit, just to solve the cutoff, quantitative cutoff too.
I have some question from Supachai Group, Supachai Rosatian Group 5. If you perform nasal swab and you found out that your swab is a pus of pus, is it okay to use it for culture?
Sorry, Supachai, can I have your question again, please?
If you perform nasal swab and you find out it is a pus, greeny mucus, something like that, can it use it to? Can you use it?
Sorry, Big. You mean pus?
Yeah, pus.
You mean pus or nasal discharge, right? Nasal discharge.
Yeah.
Okay.
Okay, so a moment, please.
We can call purulent nasal discharge actually.
Yeah.
Okay.
Purulent nasal discharge.
Purulent nasal discharge. Okay.
Okay, in case that we find purulent nasal discharge, I would suggest that we treat it like a wound sample. We wash or flush with saline, and then we swab. Then later to have the sample from active lesion like a wound.
May I explain more about my question? I think this group answer me partially correct, but not all. I think the reason why we should not collect urine with swab or transport medium is because for the urine, before we isolation and identification of the bacterial pathogen, we need to count the number or amount of the bacteria, quantitative it before isolation and identification. If the number is not is cannot interpret as significant bacteriuria or significant urinary tract infection, we will not continue to isolation or identification it. That's why we should have a urine in the characteristic of urine, not in the swab, because in the swab we cannot use it for counting. You understand me?
Okay, thank you, Peter. And is the question from Apisit Wangleum from Group 5. Is there any cases that exception that you can do the nasal swab in acute upper respiratory infection case? Okay, we've got the question and wait a minute, please.
Okay, so about the acute upper respiratory infection that Apisit asked, that is there any exceptional case that could do the nasal swab? I don't think we have one, because the main cause of acute respiratory infection mainly caused by virus, which is not be able to culture in our bacterial culture as the routine. So, but if you suspect the cold infection, we would recommend about the broad spectrum before to use the drug before then.
Thank you for the answer.
And the next question from Anasada Group 2. Can we use urine sample that had the blood like hematuria to routine urine culture? As I said that sometimes if we it's the way that we collect we just want to rule out that the blood is from the mistake from the technique, or is this the real hematuria, or is that the hemoglobinuria? So if we confirm that it's not a mistake from technique, it is not any something like complication or the mistake from any steps, I think it can be used because of especially with the cystocentesis technique, because it is the sterile environment from urinary bladder. So sometimes when it has blood, we can also do the culture from the urine and see what is the species of the bacteria, and is that more than the quantitative cutoff.
Hello, I got two comments. Yeah, your infographics quite clear, and I think it's easily delivers all the message to the peoples. Anyway, I would suggest you to convince by using this like the same meaning of the word between good, do and don't. For example, the feces in that part, for don't part, do not recommend for using for routine cultures. That would be make sense. But in another part, in do part, maybe all veterinaries or people cannot understand about the 4 selective cultures only. Or maybe you can replace by using like specific pathogens, or maybe targeting only just some bacteria or something. Is one of the indications for cultures from the feces. And also some of the informations of the urine part. Yeah, you give some additional information during presentations, like the storage times. I think that's so important that people need to know about the sample if you collect after 24 hours that would not be work anymore or something.
I have a question. In addition to the samples in the poster, are there any other kind of samples that you can send for routine bacterial culture, and what is do's or don'ts for this kind of samples?
Is the one that Pitov said before is about the CSF that can be do in culture in the blood culture bottle.
Yes, this like blood. And
yes, and I think that do's and don't may be similar to the blood sample. Yes, and another one is the tissue
when
sample.
we do the necropsy, so are there any kind of samples that you can send for bacterial culture?
It's about tissue sample and about sometimes we culture from FNA, finest aspiration, the one that we got from the needle, and the tissue sample. Yes, do and don't is it's about from biopsy. Sometimes it is the large area, but we don't do is not collect just only one area or narrow area, and don't contaminate it, clean it before. And we want to do is sometimes it can be got into the slide and just like use airflow to dry it. Yes, and not to use formalin or something like that. And got in the bottle and seal it. Yes.
Yeah. Okay. Tissue can be sent for bacterial culture too, but the recommendation is you should cut at the edge of pathological lesion between pathological lesion and normal lesions. When you do the necropsy, and also use sterile normal saline to soak them for prevention of the dryness. This is do's. And don'ts is that you said for sometimes the pathologists or the clinicians make use the formalin, but this is only for histopathology. But for the bacterial culture, the samples must not be put in the formalin because the bacteria will be killed by formalin. And for my topics, because in the next you may see the rejection criteria from some lab, because in other countries they set the rejection criteria when you collect the inappropriate samples, such as feces without any specific identifications, or urine swab. So now in our diagnostic lab in the faculty, they reject the samples. So in the next you will see more rejection criteria, and for this infographic, you should move don'ts up, because when the reader see, they will focus don'ts and do at the same level, right? And for don'ts, you can use some signs with red cross to remind, because I'm not sure when you use negative plus negative, like don't never, this will make some mistake as a positive. So you can see from the internet for the meaning and correct the phrase. Okay.
Can anyone hear me clearly?
It's clear.
Yeah.
Yes.
Okay, so you start now. Has anyone ever struggled studying feline virus? This infographic that you're looking at will give you the easy way to understand one of the most terrifying viral diseases in cats. It is the feline infectious peritonitis. Good afternoon, everyone. My name is Big, and today I am the representative of Group 5 to show you the important information of the feline infectious peritonitis, or it is commonly known as the FIP. This picture is divided into 3 parts: the virus type, the pathogenesis, and the disease diagnosis. We'll only take about 10 minutes of your time, and if you have questions, please feel free to ask at the end of the presentation. So, shall we start? The FIP is caused by the coronavirus, but wait, don't be panicked with the name coronavirus. It is different from the COVID-19 that is spreading now. It is the feline coronavirus, which is in the coronavirus family, genus Alpha coronavirus. It is the enveloped positive single-stranded RNA virus, and it has the fecal-oral route of transmission. Now we move to the pathogenesis. The FCOV, or the feline coronavirus, can be divided into 2 biotypes. Firstly, the FECV, or the feline enteric coronavirus, which is the pre-stage of the second one, the FIPV. As you can see, the red color, the enteric coronavirus prefers attacking the enterocytes rather than the monocytes. On the other hand, the FIPV in blue color prefers the monocytes rather than the enterocytes. Most of cats have experienced the coronavirus by the route that mentioned above. The virus goes through the intestines and attacks the enterocytes, causing just a mild diarrhea. And luckily, more than 90% of them are resolved by themselves. But if the persistent infection or the reinfection happens, it allows the internal mutation and can turn into the very, very dangerous version, the FIPV. This mutated virus attacks the monocytes or the macrophages. Then they go into the circulation to the lymph nodes and multiple organs. They also bring the inflammatory cytokines there. The host then protects itself by forming the pyogranuloma. We call it the dry form FIP. If the host immunity is okay, it can be stopped at this stage. But if it's not, it will progress to the last stage of the disease, the wet form FIP. The inflammation in terms of vasculitis happens in multiple organs, causing the plasma leakage, and finally, the multiple organ failures and death. And that's all for the pathogenesis. Now we move to the final part of the presentation.
For diagnosis methods, we start with physiological examination to find clinical signs. Wet or effusive form typically manifests as a vasculopathy resulting and associated with abdominal, pleural, and pericardial effusion, while dry or non-effusive form is typically associated with ocular neurological signs. Ultrasound is used for detection of small volumes of fluid in the thorax and abdominal. Moreover, ultrasound can be used to guide sampling fluid. Let's talk about effusive form first. Fluid analysis should be performed to distinguish FIP effusion from other types of fluid. FIP effusion are usually clear, sticky straw yellow, and protein-rich with a total protein concentration more than 30 35 grams per liter and make positive result from laboratory test. However, positive results from laboratory test is not specific to FIP. There are many causes to make this test positive. FIP effusion has low albumin globulin ratios. The effusions are often described as modified transudase based on cell counts. FIP effusions are poorly cellular and dominate with macrophages and non-degenerate neutrophils. Then we use immunostaining for feline coronavirus antigen in effusion samples to confirm and should perform repeatedly if it gets negative result at the first time. Both of these two forms can use liver transcription PCR to detect of feline coronavirus in tissue, effusion, blood, cerebrospinal fluid, or aqueous humor samples from suspected case of FIP. However, they are not specific for FIP-associated feline coronavirus. For non-effusive form, we recommend to do ultrasound guide biopsy from liver, kidney, and mesenteric lymph node. To collect tissue sample, immunostaining is performed on formalin-fixed tissue. Use immunohistochemistry. Positive feline coronavirus antigen immunostaining of tissues is said to confirm a diagnosis of FIP. The result of RT-PCR for coronavirus RNA can be reported rapidly, and usually quicker than immunostaining on any samples. But immunostaining can provide a definitive diagnosis, whereas RT-PCR does not. Thank you for your attention. Has any question?
I have a question. Okay, I'm Sen from Group 2. What is the factor that causes FIP?
There is 3 factors: viral factor, host factor, and environmental factor. A viral factor is the spike protein of feline coronavirus mediated host cell entry mutation in the spike gene. And the host factor is the host immune responsibility of monocyte to sustain feline coronavirus replicate, breed, and genetic. Is presented the most common young cat or old cat that older than 10 years. And environmental factor: strays, overcrowding, like multi-cat in one household. It's a risk factor. Others.
Are you satisfied with the answer, Shane?
Yes, thank you.
Are you? Really? Okay. Any other questions?
You got a lot of questions in the box.
Okay. The answer for Tiranan's question: is there any chance that the revolter test gives the false positive result? The answer is there is, and there are about two diseases such as the lymphoma and the bacterial peritonitis that can give the positive result of without a test. Thank you.
For TDIU group 3, positive result of Rivata test seems like you drop the sample and you see jellyfish-like.
To Asakon's question, I think it is the same question with Tiranan question about the false positive result without a test, and the answer has been given. Thank you.
For Pichapa, CSF can to do fluid analysis for detect or can only use? Yes, you can do fluid analysis.
Yeah, I got one question about detections of antigens in macrophages. In terms of the repeat test,
yeah,
can you explain some more about the conditions of repeat tests and just only 2 repeat tests would be effective for diagnostics, or what is the condition that we need to repeat the diagnostic?
You need to repeat diagnostics when there is a high index from fluid analysis.
Okay. From fluid analysis, still get a high values of protein levels or albumins proportions like that,
yeah.
Right?
Yes.
So
and,
how long is between the first diagnostics and the second diagnostic?
Not sure now. I will ask my friend.
And I think it's better to remark like susceptibility percent or specificity percent. Am I correct? Until now, there is no like screening test for diagnostics FIP.
Yes, there is currently no screening test for FIP. But group 5, can you tell your friends and Ajahn Boy about the FIP index more in detail? Like how can we accumulate several test results to assess the likelihood of the cat having FIP? Talk more about the index itself.
For Rivata test, if it's positive, it's not specific, but it confirms that there is high protein concentration in fluid. And for albumin globulin ratio, why it is more than 0.8, is less likely to be FIP. But when it less than or 0.8, is tend to be FIP. But if it's less than or 0.4, it is very likely to be FIP. Something like that.
Are there something else that you should take into consideration apart from fluid analysis? For example, in case of non-effusion form, are there any other case or specific clinical sign or blood chemical or anything?
For RT-PCR, CSF and aqueous humor is associated with ocular signs and neurological signs when it has feline coronavirus antigen. But for fecal or blood is less accuracy than two above.
Do you think that answer Ajahn Boy question?
Sorry, what Ajahn Boy
Ajahn Boy,
say?
would you mind kindly ask the question again,
Yeah.
please?
Yeah.
If Ajahn is satisfied, I'm good.
Well,
Yeah.
I'm not completely satisfied, but yeah. But to answer Ajahn Boy's question, there is no like screening test for FIP at the moment, so we have to like take into account every single case that we can do and like scale that on an index, like whether there is a high chance of cat having FIP, especially in non-efficient form, and to weight that likelihood on whether we should perform ultrasound guide tissue biopsy or not, because that's quite invasive and But for the question that how many times should we repeat the effusion analysis, actually there is no answer for that. Normally when cat come with effusion form, cat died soon, like within 2-3 weeks or even like 1 week after that. So yeah, the sensitivity and specificity, I would say the specificity is quite high if you can detect antigen in macrophage. Normally when you do perform a biopsy and perform post-mortem of that cat, you see the classical FIP lesion on the cat, but the sensitivity is quite low. First of all, effusion in terms of FIP have low cell content, so it's very hard to get good quality of cell to stain with immunofluorescence. That one of the issue. So sensitivity is quite low. So yeah, spec is very high.
Well, in the view of small animals practitioners, most of them still confusing about this one, and I think this portal is very useful. And some of clinicians still think about screening test by strip test testing the coronavirus, because they still think about the possible detections from that kind of the test kit or strip test. So you're gonna tell us that should not be included in the diagnostics method for FIP, right?
Group 5, would you mind answering the question?
Can you ask this again?
So the question is, can we use like coronavirus strip test and in canine coronavirus 1 to diagnose FIP? Currently, there is no feline coronavirus strip test in the market. So there is two questions then. First question is, can we use canine coronavirus strip test to test for feline coronavirus? And the second one, whether that strip test give any result on being infected with FIP.
If you use the strip test for coronavirus, it's not specific to the FIPV because it has many types of coronavirus, and it's not specific enough to use. That's the answer.
So it's gonna be false positive or false negative?
It could be false positive or false negative. If sorry. Let me brainstorm with my friend for a few minutes.
Okay, take your time.
So another question again, would you explain a little bit more about detections of antigens in macrophage? Is this RT-PCR or some others protocol of the PCR or some other technique?
So to the most recent question from Ajahn Boy, can you answer that? which technique we use to detect antigen in macrophage in the effusion? Which technique?
The technique, I think it is the RT or reverse transcription PCR because it is the RNA virus.
Seriously, think carefully. You're gonna detect antigen with RT-PCR.
Oh, sorry. Okay. Can we use the immunochemistry? Immunocytochemistry to detect the antigen in the macrophage.
Yeah, you can use either immunocytochem or immunofluorescent technique to detect that. Yes. So you perform a fresh smear of the effusion and cell lysate, and then you stain with specific antibody against
Yes, sir.
feline coronavirus. No, for RT-PCR, you don't detect antigen with RT-PCR.
Yes, I misunderstand. Sorry for that.
Yeah, no worry. I just want to make sure you get it right. So come back to the previous question from Ajahn Boy. Do you have an answer now? I mean, about the strip test.
I think the strip test can give the false positive and mostly for false positive, but lessly for false negative because most of cats have experienced the FCOV or coronavirus, but it's not need to be the FIP. So most of them can be given the false positive result. Can you understand me?
Are you sure? Yeah. I mean, in order to being test positive on an antigen detection strip test, so that means the animal must like check the virus in the feces. Am I correct? If you think it's gonna give a high false positive, that means many cats check coronavirus all the time. Is that gonna be your answer? So that means are you gonna say that the virus persists in almost all cats? Is that what you mean?
Yes, I mean that.
Okay. I mean to answer that correctly, there is no data regarding like how many percentage of cat being persistent or chronic viral chatter. So we cannot answer for sure.
Oh, okay, I get it now. Because
you know what I mean?
Yes, because it doesn't shade the virus all the time, so you cannot find it also.
No,
right?
I think to answer people's question, I think antigen test kit won't help at all. First of all, canine, and we're not sure which antibody is coated on the strip test, and so we're not sure like whether all subtype of feline coronavirus will be cross-react on a strip test. So I would think that there would be a lot of false negatives in my opinion. And secondly, being finding coronavirus in the feces doesn't mean the cat have FIP. It's just coronavirus. But there is the data showing that cat with FIP higher level of virus in the feces than non-FIP cat. But we have no like direct connection between but yeah, of course, you being chronic chatter, that means you have virus persistent in the cat, and that have high tendency to become FIP. Yeah. So we don't know for sure the yeah that.
Thank you.
So what about PCR? If we perform RT-PCR on the fecal swab, rectal swab, do you think we can use that to screening for FIP?
It's not sure that it's shedding. So we shouldn't taste RT-PCR on feces or little swabs.
Why is that again? And I'm not sure I got the answer. You don't think that would bring any more information on that?
and it has about 50% that have false results. Can I ask again, FIP or feline coronavirus that you test from RT-PCR?
No, it's just a question like, should we, do you think performing RT-PCR on rectal swab or fecal sample be used as a screening test for FIP? Because people are asking about detecting antigen with strip test, right? And you say it's not going to work. So now I'm move toward RT-PCR with the same purpose. Do you think that will be any?
For paper, the researchers say that feel like you can perform fecal RT-PCR on fecal sample, but fecal feline coronavirus RT-PCR is not used to aid the diagnosis of FIP.
And why is that?
But FIP are more likely to be shedding than feline coronavirus in a higher amount of feline coronavirus RNA.
So do you think if you found high viral load in the feces, will that have any correlation with being FIP? I mean, will you use that to assess whether the cat have FIP or not? Or you don't think it's gonna be you don't think it's gonna work?
You can notice it, but I don't think it is useful. There is many things that.
Okay. Yeah, we currently not using that for screening test of FIP. It's not very helpful. So moderator, is it time's up now, or are there any other questions from another group?
Questions left in the commentary box. The question from Miss Priyanit: are there any complications or symptoms which make us confused between FIP and other diseases? Yes, there are. The disease that is reducing the plasma protein or the oncotic pressure in the vessel can make the host act like FIP, such as the protein losing in nephropathy or the cirrhosis that reduce the protein plasma. Thank you.
Okay, thank you, Cuvet, and thank you, every group. Well done. It's done for today. I would like to thank you, everyone, for attending here. Such an honor for me being here as an MC. If there is any mistake by me, I need to apologize. ขอบคุณครับ
Thank you very much for your great performance, and today you are very good moderators. So thanks you all, so including especially อาจารย์พี่ท็อปพี่เดิร์ดพี่อีกนะครับ for giving very valuable comment and these opportunities. You show a lot of great performance and you created very good atmosphere in your class. There is another best class in this year, and I wish you will satisfy your grade. And of course, as a rule, I have talked to your leaders. So there is a competition from your infographics, because they will be published in the website, and the best one that got the highest number of like numbers, share numbers, and engagement numbers, you will get 1,000 baht. And the first runner-up, you will get 500 baht. But the third, the last one, you will get this one. I give you fit. Okay, so try your best and make it happen. I believe in you always. Then the final word, I think some of instructor will give you the final remark in here. So how about all the teacher here? If you still here, you can give some comments. อาจารย์เดิร์ดอยู่ไหมอาจารย์ท็อปอาจารย์อีทครับ You need a fish?
Yes.
Turn on your microphone, please.
I don't have a specific suggestion, but I just would like to admire everyone. You do a good job. Yes, especially infographic. For my group, I think it's above my expectation a lot. Yeah, it's very good, and all the group also good also. For the score that Ajanui give to me for evaluate, I think it's hard for me to give the score. Can I give full score to every group? Okay, thank you.
Thank you.
And give me one fish, please.
ใช่ครับอาจารย์ท็อปอย่าลืมเปิดไมค์
ครับก็ปีนี้เป็นปีแรกที่เรียนออนไลน์นะครับแล้วปกติคือก็เคยทำเกมแบบนี้ให้นิสิตปีที่แล้วเล่นก็เลยมาลองให้เราเล่นดูคือส่วนใหญ่แล้วก็คือเราก็ได้รีมายด์ความรู้ที่ได้เรียนไมโครกับทางฟาร์มาโคด้วยนะครับแล้วก็เทคนิคต่างๆมารีมายด์ก็รู้สึกว่าเราได้รับ assignment มารู้สึกว่านิสิตทุกคนตั้งใจนะครับก็เลยเนี่ยคาดหวังว่าเราจะได้ความรู้แล้วก็ประสบการณ์จากการเรียนในคลาสแล้วก็คำแนะนำจากอาจารย์ทุกท่านเนอะไปใช้ประโยชน์ในทางคลินิกนะครับเก็บตัวอย่างอย่างถูกวิธีนะครับแล้วก็เข้าใจขั้นตอนที่เกิดใน lab แล้วก็สามารถนำผลไปใช้ให้เกิดประโยชน์ได้นะครับ
ผมไม่มีคอมเมนต์ใดๆก็ดีอยู่แล้วครับ
อย่างนั้นขอบคุณทุกคนนะในปีนี้ก็ผมถือว่ารู้สึกประทับใจนิสิตทุกคนเลยนะครับที่ช่วยกันเรียนแล้วก็ช่วยกันถามแล้วก็มีคำถามค่อนข้างเยอะที่มีน่าสนใจมากมายนะครับแล้วก็ทุกคนรู้สึกว่าให้ความสำคัญกับเพื่อนดีนะครับในช่วง New Normal อย่างนี้เราต้องปรับตัวค่อนข้างเยอะเนาะนะครับแล้วก็เรื่องของ distancing ทำให้เราเข้าใจกันอาจจะน้อยลงถ้าเราไม่สื่อสารกันอาจจะทำให้เกิดความเข้าใจผิดกันได้นะครับอย่างไรก็ตามนิสิตสามารถทบทวนความรู้ต่างๆนะครับที่เราให้มาเนี่ยผ่านทางตัวซอร์สของตัวของMicrosoft Teams ที่เราฝาก ไฟล์เอาไว้แล้วก็ใน Facebook นะครับแล้วก็ถ้ามีคำถามอะไรส่วนของ Line Group เนี่ยก็ยัง available สำหรับทุกคนอยู่นะครับทีนี้อาจารย์จะประกาศผลเนี่ยหลังจากที่เราโพสต์ไปแล้วภายในสิ้นเดือนนี้นะครับแล้วก็ถ้าเปิดเทอมแล้วก็ค่อยหาเวลามารับรางวัลแล้วกันนะครับอย่างนั้นวันนี้ขอบคุณมากนะครับก็ขออนุญาตปิดคอร์สแต่เพียงเท่านี้สวัสดีครับอย่าลืมประเมินให้อาจารย์นะครับสำหรับคอร์สนี้นะครับทุกคนทำดีมากครับ
ครับสวัสดีครับ
สวัสดีครับ
สวัสดีครับ
ข
ข
อ
อ
บบ คุ
คุณ ณ
ค่ะ
ครับ
ขอบคุณค่ะ
ขอบคุณมากครับ
ขอบคุณครับ